No pain. Because after about 2
Now
months,
is the kneecap still in the healing process?
she actually very hard to walk, but immediately after pressing, she walks properly. 2 days, is it yesterday or 2 days, auntie came along, 80 years old.
Yesterday
Hardly on the wheelchair, hardly can walk. But after pressing on the buttock,
look like Bing Ching.
she already got hunchback. That means already, thank you very much.
No,
So
look,
it's already walking like that. But
Yeah, like
immediately
Bing Ching.
after doing, she just walk like that.
Wow,
Immediately.
Immediately. I have a stiff neck. So how?
Stiff neck.
Stiff.
Every time, every 24 hours.
Many years, about 5 to 10 years.
Achieve how you can do
Muscle
for it.
cramp.
No, last time I used to.
No, you said the other way.
The other way.
Last time I did exercise. Then I have this problem.
Are you having the problem now?
Yes. A few years by.
The back
Yeah.
also press cannot.
Very hard.
Oh, okay.
I'm trying to do something where I'm going to attach to the wall so that I can do myself.
Oh, elephant do that as well.
Yeah.
Against
Yeah,
the wall. Last time we
but-
rock against the pillar.
But the thing must be movable.
old chair can move.
It has to be sharp enough, like a point like this,
cannot.
and then I can do it. I'm trying to think how I can. I got the thing, but I want to think of how to do the thing moving up and down because the whole spine got to be done. So far they have not learned to do for me, so I still don't know which part is painful. So far I don't have anything painful, but I.
Your fingers is a thumb or you use?
They are the instrument itself. The instrument itself. This one is one very good instrument that goes very deep. At buttock we have to use this. Go right deep inside because there are a lot of flesh there. Here is where we don't, like the person is very painful. We cannot use this. We probably got to use this. And for some people like my mother, 80 years old, she can hardly lie properly, so she's lie on the side. I have to use this. So from the side. I mean, she lie on the side, you have to do from the side. And so this one, and this one. And for this, we help them to, what they call, soften the tissue, the muscle, because we are pressing the nerve right inside, below the muscle. So the muscle can be compressed, so we use this to rub. I show you. So for...
My one is here, this point.
So whenever I'm too painful, then he will use this to soften.
Wow,
Then he
very
kill you again.
Very romantic.
This one is very much near to the head, so I will do the head for him, and then also the upper spinal cord here, and then it's not the point that he pointed to me. It's actually just at the side of the backbone, the spinal cord, this area. So I will do this. If it's too painful, let me know. Bearable?
Yeah.
Bearable?
Pain, yeah.
A bit pain, okay. Pain?
I think you must turn the aircon
This is the
lower.
point you must do yourself often.
So hot now.
Every day you do yourself, this one. Because this part you can do. Do you have any head problem or anything?
No.
You do yourself.
Wow, pain.
Or pain, that means this part there's injury somewhere in the head.
Study too much.
Obviously, this part here, he has to do every day. This one you can do yourself.
You press too hard
Because
with it.
this press I press harder, but no pain. It's only when I reach here. You see, this whole line below the skull, there are 4 points. 1, 2, 3, 4. Only number 3 and 4 is painful.
Doctor, no
So
pain.
this number 3 and 4 is connected to somewhere.
No problem.
And
no pain.
this area actually solve all the things on the head. Parkinson, for example, if you are moving, Parkinson, dementia, depression, all this can be solved by this.
My
And
hearing
hearing,
also improve.
eyesight. Afterwards, you probably see, you see things clearer. Immediately after you see whether the things are clearer when you look. So for him, he has got number 3 and number 4. I don't know about the other side. I try the other side. Any pain?
Not so.
You see, this one no injury, no pain. So here is number 1 point, just below the skull. Any pain? No pain, you see? No injury, no pain. Same pressure. Eh?
Yeah,
Pain, huh? So this one got problem. You do this more often, huh? Every day you do. The number 2 point. Number 3 point, any pain? So here is number 2 and number 4. So every now I do this. Anyway, you get up and feel a bit and see whether it's better. Do you see things the faces are clearer?
I think he's more handsome, no?
You see a bit better, you feel better or not?
Maybe, but I think the effect will come slowly.
No, it's the right point is immediate.
Oh,
There's no such thing as slowly.
possible, possible, yeah.
So if you're in the spare time, you use a finger, you put it like that, and use this thumb to press it here so that there's a knot.
You see clear? You see clearer?
So
Very much clearer.
for him, every day without fear when they're free, just open the ear here. Then there's a depression here. Just push it in and go up and down.
But this is not number 3 point.
No, I'm just saying, do all maintenance.
This one.
Then when you reach number 1, there's no pain for you. But number 2 and number 3 is very painful.
Yeah.
So do 3 and 4.
3 and 4, not 2.
3 and 4 and the other side.
Is it around here?
You see there's a
Is it around here?
the skull is here, just below the skull. So
Okay.
there's one line just below the skull. During that one line is 1, 2, 3 and 4.
Okay.
But don't touch the bone. If you are not supposed to do the bone will be inflamed. So it must be below the bone.
Okay.
So every day you do until the pain disappears. When the pain disappears, your problem solved.
Okay, thank you.
Actually, you will feel there's a hole.
Any way to improve eyesight?
Yeah, this is the way.
This is the way.
This is the place.
So after that, no need to wear glass already.
LASIK surgery.
Well, I was once when I was young, I'm 800 degree.
Wow.
But now I don't wear old man glass, I mean the long sighted glass. I can read from 1 inch. You can give me something to read 1 inch, far away, all I can read.
No, but we went for this
That was
retinal
20 years ago.
cataract. But after that, we did not deteriorate.
No, it's about, it leave you from 800 to 400, not 0. Then about 400 you stay there. But then you can use
For
your,
mine, absolutely
you
correct.
can use your this other
So the
way.
hearing also the same thing.
Yes. I'm now trying to help her on the hearing because at the moment it's just improving. She's no longer using hearing aid, but still
So
not
then I
to
use
the,
but even if I don't, it's still quite okay. Just that less control, less noisy. Yes, this one easy because you just hold your hand and then you do long. You see?
yeah,
Ordinary, no pain.
yeah. Your neck at the moment.
No, but when only when I climb up the stairs. But not every day.
At the moment, do you feel pain when you walk?
Boring.
If you feel pain in the walk, you can easily see the difference.
But only when climb stairs, but not every day. Sometimes certain days.
No.
Because you can do maintenance like what I did for him. You can do yourself. Because this area you can do yourself.
Then where do you press for the
Here,
kneecap?
the kneecap here, the 2 lines,
The other way round. That's why I also no need to wear.
the kneecap is here, the 2 line here. There's a 2 depression here.
Okay, press the two.
Yeah, just keep on pressing the 2. For example, in my case, there's no injury, there's no pain, no matter how hard I press. But you do the maintenance yourself and you will see there's a place where there's very painful. There's a part that you must do more.
But the pain is inside here. Inside here.
Yeah, but this is when you.
Sit down and
Not every day. Only
I see. Maybe I check
on certain days.
when I press whether it's pain.
maintenance.
Actually, even if you press wrongly, what harm is no harm?
Yeah, okay.
There's no side effect. If you eat Panadol, maybe you can damage your stomach. But this one no harm. You you press correctly, you will have a chance of recovering. You press wrongly, what is the harm?
No pain.
Okay, so normally we put the leg 90 degrees and then it's along these 2 points. Anything? 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 Here is the part. Here is the part that you got to press. You can do it yourself using this. Put the finger here and then like that. And this is the point.
This finger or this?
This first finger. If no effect, you can use this also.
Cannot say.
If it's too painful, you don't press too hard. But this is the part that will relieve it. Then there's another side here, this side. I will do, if it's too painful, you let me know. Any pain? So your point is here only. So this point, whenever you are free, you do. Okay. This is the point. So after some time, next time you can walk the stairs and you find perfect better.
Okay. But not every day, certain days only.
After doing, you try lah. Okay.
Just learn that the temple people do volunteers.
How about injuries? Oh, injuries. For example, I fell down in 2 years ago. The back. No pain, but I feel uncomfortable.
This one you need to have a bed.
Every Saturday morning, we let people open for people to go there, and then they'll be volunteer doing it. Maybe after you tell them.
There's a lot of volunteers.
You learn this technique.
I show you.
Go hotel, they will be great.
I can take it now.
No, are you going to show that on the website? Then you will.
Yeah. Hey, but how come this one now black out? 9100
PT or OPM?
0054. David Chua.
4054. 91 and 54.
The amazing part, have you ever heard of S-spine?
Oh yes, Synopsis lah.
Many of us has got this problem.
No, not
The spine is not straight. It's like an S.
Yes.
She has it since birth. But after manipulation, the spine is straighter.
Put metal lah, put metal rod.
No, not so bad lah.
No, just
I
do-
don't need metal rod. Mine got quite straight.
Is there a way to improve on floaters,
Yeah, same place. Yes, yeah. There's the same place. This everything regarding the head, that control by the head, is all this point. 1, 2, 3, 4. Do it yourself because this one can do. We can reach. We can use our hand to reach.
No, I straighten.
And generally, I went for tree laser.
For people who suspect hemorrhage, or have to go for operation, before operation, give yourself a chance to do it, and you find that it might disappear, and it can be quite fast. Even her backbone S, it takes less than a month.
Not serious as lah.
Oh, very serious.
No, I was born with it.
And she walked with like that.
Macam
Very often, earlier
No,
part.
I slant. My head slanting.
Yeah.
Like you all know, my head always slant to one
Then what
side.
about cancer patients?
Oh, okay, that is.
Maintenance.
Yeah, we do the maintenance. It depends on where the cancer is. For example, if the cancer is in the liver, so when breast cancer is around here, around this, the breast here. So around this part, when you touch it, you'll be very painful. Do until the pain is no more. Keep on doing the part.
Near the organ.
Yeah, it's the exact, but it's slightly higher by 2 cm. So
Only is higher than the organ.
see the organ is here, the direct one is here, but it is a little bit higher, but it's all the time along the backbone.
Not at the backbone, but about
One finger space.
1 finger space.
So if this is the backbone, say this is the backbone, I put the finger here, then one finger here is allow this area.
I know what about legs. If it is ankle.
Ankle is you have ankle pain now?
No, my mother.
Because ankle pain is you can get the relief immediate.
By pressing. Maybe you show me on the. Then I press it.
Anybody got ankle problem now? Or any feet problem?
Anyone who's
any sole problem? When you step on it like needle poking. Anybody? Anybody here like when you step on? Anybody who has like when you step on the floor, especially in the morning, you feel like got needle poking your leg. Anybody? No, don't have. Anybody who got feet? Then I can immediately show you and then.
So you show me the
Okay,
ankle.
maybe you put your leg here. Then I can. Anybody who is interested in this, which part of the pain is? Okay, the pain is here. Then it is here. This point. Any pain? No, not you. Okay. And if it's a sore here, it's actually here. The point is here. And if it's the center here, it is here. But here,
all around the ankle.
yes, the round ankle is the here. Here is here. But if it's a toe pain, it's here.
So that's the spine only.
1,
All right down.
2, 3, 4. See like this. And if it's nearer to here, it's this side.
So what about the toe cramp? Let's say
Then, for example, these two toe cramp, you have to leg.
because sometimes you get cramp in the morning.
But don't touch the toe, it's here.
Like the fingers, right?
Yeah, correct. These two fingers. So actually, they're all together. Ankle is all as I say the way. It is ankle here. Actually, all the whole body is only 8 points. So you just study 8 points. No, this is considered one area. 8 area. 8 area. 1 area, 2 area, 3 area, 4 area, 5 area. 6 area. Then the head is 7. Then there's another one. The other 8 areas. So it's
there a website?
oh yeah.
Okay, now you all sit down, then you show yours.
You can go to the website. I learned it from the
You learn
website.
everything from the website.
Anybody can learn website. But why the computer now?
This is
More with liao.
Screensaver.
how to start? Just press
How
up.
to
No
start?
signal.
Screensaver lah.
Oh, like that. But my thing also gone.
Enter.
It's very interesting because as we grow at our age now,
you must do your backbone now.
Tomorrow work straight only. Cannot straight one. My
Meaning when you start backbone getting not
don't be
straight.
surprised. You like S5 also can do.
Since
Can try
But if you anybody who want
started to get some, I think it started at 16, maybe it's 30,
Huh? When you're
35 years
30,
ago.
can straighten.
this there is a 普及室 in Lorong 12 Geylang. 普及室 they have been doing it for years. And they are volunteer. They are doing volunteer. I'm doing advertisement for them. Every Saturday, every Saturday you have to go at 9 o'clock to get there. About
Wow, is that the most popular? The most popular.
Write down.
Use your phone and take a photograph.
My head is so stiff.
Huh? Don't know. Watch it. Never. Cannot check in.
it's a bit longer.
No signal. You know what? Input until HDMI. Yeah. Okay. Yeah. Where's your website?
Go to my thumb drive.
Oh, thumb drive.
This Johnson said super. I said
David Chua.
You never recognize the thumb drive. Sis never recognize the thumb drive. Is your thumb drive there?
Just the mouth. Eat less.
We exercise, we avoid the 3 white sugar rice. Avoid, that means try to be free less lah. Then exercise, and then for us, go to gym, my daughter go to gym. For me,
Okay, this-
I've been using Pilates.
This website,
Back-
this website is the English version. There is an English version. Okay, so this is the website in English.
I think they want to take a photo of that one.
Maybe later you come and take. Later you see. Look at yeah. Okay. This is the website.
Take here lah. Take here.
Anybody who go to the website, pay spend some time on it,
Become clearer.
will be able to learn and will be able to do it.
But you can write down lah.
No, it's not PowerPoint. It's
It's
the
written way.
internet from the internet. So what I do is I will control and then I click.
Hello?
Color come out.
So now he's gonna open for you and you see what's inside there.
Some supposed to get color.
Yeah, Shenton, where are you?
Color, eh?
Others don't have this color.
Yeah, we are SMS. Yeah.
This projector work.
I don't know, maybe half an hour,
No, I think the one on top.
How about
Is it different different email number?
Same.
Same.
Is the bottom that one, is it?
Is
Yeah.
you mean the website? Is it?
Website
Website
is
is the top that one.
on top that one.
But it's a PowerPoint, right?
How
Yeah,
come?
you can download as a PowerPoint.
How come cannot move?
Website is
Got color, what you want? No color.
Okay.
Got color, right?
So as you go around, the topics are here. The contents, introduction, skills and techniques and all that is quite clear lah.
Oh, this one got
You just have
PowerPoint.
to go.
It's
You
a
just
book.
have to go
It's
and
not
you see how
I like
how the
PowerPoint.
manipulation is done,
Everything PowerPoint.
and it's in all in English ah.
Then see my one.
Introduction.
Color.
Then they show you the positions of the spinal cord, the 2 sides.
So it's all
This
there.
one got they got the movie and YouTube.
You got a lot of it.
This doctor
A lot of it.
This one.
Yeah.
Some people ask me, but I
He discovered.
never.
I suppose Taiwan.
They got the VCD.
No, someone translate. I
It's the
think
same point or this one.
people have
So
been
how do I
spreading
go back
this
to
word.
the thumb
Which
drive
one?
again? Okay, go back to
The thumb drive. Thumb
So
drive is
just now that one is all the Chinese, the English version.
thumb drive is here.
Okay, thanks. I let you all watch the manipulation part. This one, the way it's manipulated is done this way. We call this not massage. Massage is soft, fun, but this is manipulation. Is curing. Curing. So it's not massage.
It's a point. If let's say you select the point wrongly, how?
I will no harm. Bow Tai Chi. Nothing happens.
No side effect.
No side effect. Just like you press your hand, no side effect. Bow Tai Chi, Bow Tai Chi.
Because the
No.
Like TV TV. You hit the wrong one, you just station there. Don't move.
So these are the
Maybe
manipulation.
somebody can pull you.
Yeah.
Okay, hold on. This one don't take away.
手法学习
This one.
教学学手法教学
Can
Oh, colorful.
Okay. Can I
Very
go in
colourful.
just one
the
of
scan
them.
rate.
I think
The
very
scan rate
colorful.
slow, that's why you see all the color.
Is it colorful? Very colorful. That. See?
Yeah.
All the 8 areas,
scan
it
rate.
show you where are the
I
8
see all the
areas
color.
in
You
detail.
see the
Right?
color? Very colorful, no? I send to you. Later, then give me your. I send to you one by one. Normally I select then send 20 all picture.
Once again,
I need to order.
You see, you look at it's the internet.
the whole
You look at the YouTube. Here are all the YouTube. Okay. You can click any one of them. They are all there. This is actually YouTube.
you go Google search the original point therapy, then you get in also. So not a problem.
My number.
50高手。
我我不要是的。
现在我们来讲
That's the
This is the
best.
doctor from Dr. Tai. He was in Singapore in 2006.
中间这是脊椎，就是按在两旁。Okay, thank you.
So he teach you where the exact point. So you can learn exactly from him in the exact area. Very, very accurate. And you can go to how to manipulate fingers and so on.
第二个，
You saw the one that 44 video, you click on 44 video, then you got all the 44 video.
This one is recorded in 2011. But he has already so many years, 2006 until now. In Singapore, he is in Singapore in 2006. And now I know of this center who is doing voluntary. And one day they see 100 over patients. So you have to be early and then you probably have to wait. But the volunteers there are people like me doing all this thing. But I'm not a volunteer yet, I'm not qualified yet. I learn from internet. Look at that.
Yes, he learned from internet. They learn through him.
3,000 meters above sea level lies the unspoiled Tibetan highlands in this vast sanctuary in Chongqing.
This one, no medicine involved. And there's no serious opening of the organ or anything. Impossible to die. No effect, that's all. If it's you press wrongly, no effect.
You know, press too hard, the ribs are broken.
No.
The ribs crack.
Actually, CPU
Before that, you already
cause a lot of broken ribs.
Ah,
Because like this one, if you got coming, let's say you unconscious because of stroke, in 1 minute you can revive him back before the ambulance comes. Just by pressing those points. If we go through the videos, you can understand that he has saved many of those stroke people. They are already unconscious. That means they already got choking and coming already. So within 1 minute, you press those at the back there, the person just come back before the ambulance comes. And like nothing happened after that. The ambulance just go back.
The second stroke will come.
Well, the thing is that the emergency is taken care of. This explanation is that, this expression is like this. Many people who got a stroke actually got cooling body. So the moment the ambulance send him to the hospital, they will do a lot of checking. Now this checking takes time, half an hour, 1 hour. And for stroke people, every minute count. So when he fell down immediately, you can do, you save a lot of future problems. So if you wait for 1 hour and you go to the hospital, you remove all the clothes, already cooling body, and then aircon go in, all the nerve will cramp more. So you are before you open, you put the knife in already, a lot of problem. So you will be a lot of cases become a vegetable. But most of these people are cooling body, and cooling body, aircon some more. After all the check, the golden time is gone. The golden time is the first few minutes. Is very important. So if you can learn some of this, get the family members to learn about at least the stroke or the heart attack case, where to press in case you fell down. Before the ambulance comes, please do something. Don't just wait there and do nothing. I think it's a good.
So this one can replace CPR.
Definitely. CPR actually break a lot of ribs, you know. So some people are very big size. They try to revive, and many cases they have to survive broken ribs.
But they say broken ribs is okay than dead person. We went for SCDF course, they say never mind, break, crack, never mind. Say continue.
If there's another way, for example, if you can save that particular first few minutes, instead of wasting 1 whole hour, the ambulance going to the hospital, checking in the aircon room, and the operation room still aircon, very, very cold, the person actually becomes worse.
So heart attack when you rest.
At the back there. If you go through the video, there will be, you will see how he saved people from heart attack and stroke on the spot. Because there are many people, they went to China, some doctors are attending, the Chinese doctor attending, and on the spot they have a stroke. Immediately carry to the front, immediately do. And the camera is all there. So after doing it, the person just like normal like that, no problem. No need to go hospital. And all these are inside there. The Chinese version.
I believe if they no, then you refer say, for example, the 原子点 trainer, they will say, I'm 原子点 because I'm 3 原子点.
Of course, it's a matter of we try to have an open mind. Today I just gave an introduction because I feel that all of us should come to know about this. Then further from this introduction, now that you know about such a thing, such a therapy, it's up to you whether you want to pursue the matter. Because in the internet, all the things are out there. So yeah.
Is there a proper training center beside the internet?
Singapore so far not yet. Malaysia a lot. In Malaysia there's a lot of center, but Singapore only do the treatment. There are a few volunteers there, but I don't know how many volunteers. But I know every Saturday they do for. They start at 10:30, but you have to go by 10:30. You have no more number. You have to go at 9:30 or what to get the number. And Lorong 12, the Puqi is a very big temple, Buddhist temple. I do not know how many volunteers, but I know that each Saturday they see 100 over people. That means they just come in and then they just do. And many of them are cancer, stroke. They come on wheelchairs.
Is it the very big Buddhist temple?
Very big. The moment Lorong 12, the moment you turn in Lorong 12 is there, on the right hand side. It's the first building on Lorong 12. So you can go try, but on the 24th, they have a holiday. I think the place there, there's some function.
Vesak Day,
Oh, Vesak Day. Oh, no wonder. No, it's 24. On 24. 21 fall on Saturday. On the 24th, don't go. But tomorrow, okay.
Tomorrow he's going.
I'm accompanying a friend whose wife got stroke. So now he's going on a wheelchair and bringing her there to see how they can help her. I said these are people I've been doing it for so many years, better than me who just know it not
We
very
only
long.
learn from the.
So I say if you really got a serious problem, go there and it will be something interesting. And even if you don't have any problem now, it's good to know that there's such a thing exists. In case your family members, I mean besides medical treatment and all that, there is something which you can do for yourself. Because we know there is a limit of what medical science can do. It's not a cure-all. It's not something you can do for yourself, like converting your cooling body to a less cooling body, like ginger. It's a very simple exercise you can do. Every morning, just take 1 cup of ginger water, mix with whatever you like. Ginger with milk, ginger with honey, ginger, coffee, but not ginger tea. Because tea is cooling. Because you already got cooling body, so tea is out.
Coffee
Get
not
the
not
ginger,
cooling.
the packet from the
No, that one useless. You must go and buy the real ginger.
Grade
The fresh one.
it.
You grate it. After you grate it, you just take the thing and put water.
put
Can
in
I
the
ask
fridge.
you the ginger itself can cause a stroke? Because they got sore throat, when they take ginger can cause.
No, it get it better.
Ginger lah.
Get it better.
Sore throat is actually cooling body.
Got throat heaty then sore throat.
But be careful, don't take too much ginger. You cannot overtake also. Overtake you might get constipation. Yeah, high blood is actually cooling body. Lemon is cooling.
Lemongrass is ginger ma.
No,
Lemongrass is not
Okay,
ginger.
talking about
The
ginger,
ginger shoot
there's this brand of coffee called Coffee Hawk. You all know?
What coffee hot?
Coffee Hawk. It's a Malaysian brand.
Coffee
How do you
hot.
spell hot?
HOCK lah, coffee hot.
HOCK ah.
Actually, they make all this coffee powder, no? Recently, they introduced ginger powder. Ginger powder. They said ginger, they grind already into powder, then there's less sugar. Okay, it's one big packet.
Oh, this one, I want to take this.
400.
Excuse me.
It's about $4 lah, $4.
No, then you don't need. If you are talking about ginger powder, you just buy ginger powder, no sugar.
Where to buy ginger powder from?
Ginger powder, any Indian shop got.
Actually,
I don't know where, so I buy coffee hot. Coffee hot ginger.
Sing Song got, go Sing Song buy.
But Synopsis, they actually promoted this.
No need.
I bought one.
No, you don't buy that one, you go to
Higher
the
profit
cooking
margin.
one. You go to the cooking one, the cooking spices, you will have ginger powder.
Really, I never seen it.
So migraine.
Go and see again.
Now can go and see.
Migraine.
migraine is the same place.
You go to the
On the
Also,
before.
like, take a lot of time.
And the effect is
This
immediate.
powder is just one spoon.
Sing Song has
She went there, she bought it, because she must have.
So what is the brand?
no brand.
No brand ah.
Okay, Sing Song, you
Is
go
it
to
dry
the
one, dry
food
one?
and food, Giant, everybody also has.
No, but dry one. No. Is it dry? Dry. That means must it the.
About ginger powder, it's very funny. Of course, yellow ginger, turmeric, is also a very, very good ginger. Yellow
Those are
ginger.
spices really. Those are the curry spices really.
No, you can eat. Just
Can
that ginger powder is very good if you have QiGong, stomach wind, cannot indigestion, which indigestion can cause headache, cannot sleep. All these things are related. 万事归土 the tummy is our 土 if you can assimilate with ginger powder, things will be good.
I'm going to
Sorry.
show them this. This Dr. Chen came to Singapore.
Yeah. Go look for
Don't
it.
bother about the powder. It's not very good. Fresh one is better.
Great one, great one.
Fresh one, troublesome one.
Chew in the mouth can already lah.
He came to Singapore many years back, and then he started this in Singapore. But so long up to now, he haven't come to Singapore yet. But in Malaysia, he came quite a number of times. And he himself has done thousands and thousands of cases all over the world. And he just say what he done and what happened to the patient. And he has videotape, all this videotape to show you how you see the patient after coming limping like that and how he walk out like that after manipulation. So it is something you can see with your own eyes. He started with his wife getting cancer and then he was telling himself, I cannot cure my own wife. What type of doctor I am? I'm a useless mother. So then he started.
So his wife's death became his mission.
So, but when he says when the wife died, there's no pain. Totally zero pain. So he was able, before she died, there was totally no pain. He managed to find all the eight areas, and every day he manipulates all the 8 areas, and all the pains are gone.
Why don't you show us the 8 areas?
He's already take all the 8 areas. You have to go through the tapes.
Oh, okay. One by one, we all go and.
So anyway, I'm just introducing all this to you all, and then from there you go into the. You can copy. You can copy all the websites, the link and all that, and then there are tons of it. So you just one by one go and open it. It's all in the internet. So later on, anybody who is interested, copy all the links.
Okay, 10 minutes for questioning. 9:15 we finish everything.
Can you let us know? Oh, okay. Anybody interested in what is inside? Okay, the 补气, we increase the energy.
And what is the ingredient?
Huh? The ingredients is
Got white marker pen now.
Not white lah, black or blue lah, white can see lah. Why you want white?
Okay, black marker pen.
And then
Husband and wife.
首先感谢主办单位这一次这么用心来
来举办这一场原始点，还有尊敬的各位长辈、老师，还有各位朋友，大家好。
张健汉。
我们今天要来跟大家分享的就是原始的松筋健康保健法。那这一套，我相信很多人都还没有听过。在场有没有人听过我演讲的
？At least 6 years old
一般都
Jensen
没有听过。
Lower than that, your Jensen is just
我就
vegetable
开
by
始
the
来
way.
先跟各位来介绍我为什么会
Korean one
去
is
研
Korean
发
Jensen
这个
3
原始
years
点。
old.
1 year old is the
它的
carrot
意念
noodles.
是
3
在
year old not so good.
6 years
but 6 years old is a bit
话说从
more.
头，这个应该从我
Older
太
it
太
is
讲起，
translated this.
因为我本身是中医师，行医
Yeah, because 3 year old but 3 year old not so good.
You write down 那一般大家都知道中医师，像我开一个小诊所，来会给我看的，不外就是一些感冒啊、肠胃病啊，或是一些小儿鼻子过敏之类的。我也希望说这几个日子就这样平平淡淡的。
Use your machine.
至于我在想，医学上一些重大疾病，应该都不会找我。比如中风啊，他中风了一定会送大医院。癌症呢，也不会跑到这个小诊所来找我。所以我也认得这样每天这样过自己的日子。
Woodberry is the red berry.
但直到有一天，
American ginseng 有多少？This is
我的太太
黄金的黄金，
身体健康检查
red
查出
like that black
她
color.
得了癌症，
I drink this under
这让我有一点挫败。
黄金。
Can you write Chinese
I
beside?
can't write in Chinese.
开始让
黄色的黄，金。
开始有点大不一样。
in excess
当时我就在想，
less
我有没有能力来
if
帮
you
我
want
太
you
太
want to
治疗这样
prepare
世纪大病？
Just
Boy ah.
no need, just pour hot water.
我现在想，
Boiling water.
This is the fourth time.
黄金哎，what is that？
Oh,
黄金 is like
我
red
想
after
就
you
我
see
想
after.
现在西方医学这么发达，
How to say all drank by you already? Hello, you must pass around lah, pass around. This one take one seat.
No, I drink
我
the
想
not nice. The 黄金 is the black color one.
相信西医，
What is
The
that?
black color. You have to pass around.
English call what?
黄金 No,
所以我太太
the English name I am not very sure.
果
橘子还有什么？
她也同意，
黑黑的是什么？
黑黑的黄金。
所以我们
黄金呢？这个是金
Now
身
all。these are 补气 that means you get more
找一个
points.
Another one.
This one the
Very
seat, this one 高级 I know 啦。
高级
this one.
Yeah, 高级。
她看完说，
This formula
其实
is
4个
written
就有一个
5,000 years ago
很常见，
by the
让你
emperor's
太太知道
doctor.
的乳癌、
Very
的金身 is one.
现在赶快说，
You know, last time the emperor has got so many
Three only.
doctors to look after you. They call it 黄帝内经.
红色的是国际。
So if you go to 黄帝内经, you find this formula. It's called 黄金汤 or 黄金地, 黄金茶.
金was
So it's already emperors have been drinking for the last during the time during emperor time. So because the doctors if they don't protect the emperor they will just not very easy to survive. So they must every day make sure that the emperor is surviving well. So they think of some water that for him to drink every day. So it's very common things actually. Any other things that you all like to know before we call it? 补气的。Young people don't take too much. Too much tea.
not young already lah.
You still younger than you all what?
This type of 补气 is for seniors very important. As we grow older, like your coughing all this, the moment you drink this, your coughing stops. Because most of the coughing like this are cooling. The body is cooling. So if you add more qi inside the
黄
body,
金啊，对的。
黄金
这个呢？
Yeah, this one. There is a biological name. It's very hard to call.
So write the Chinese word lah. Write the Chinese.
It is like Play-Doh, no? But I cut it small lah. It's a big piece.
Where's the pen?
So you can.
Just put in the water. Just put in the water and then pour hot water.
Then how many times can you do it?
Now I do 4 times.
Or 4 times.
4 times until no taste lah.
Then you
How
can
often
get
do you drink it?
Huh?
How often do you drink
Almost
it?
every day.
The whole day.
第二个是什么？
It's better than drinking Pepsi-Cola.
这个是什么来的？
这个是黄芪。
So how much you can buy?
北芪。
你去
北芪
you
北芪黄芪一样。
北芪。
北芪黄芪一模一样。
So if you go like the consultation, you ask the Chinese.
You ask also can, no need thank
Oh, because you buy in bulk.
You buy about half a kilo of each and then you just for people who are like your parents who are always the finger all very cold, the toes are very cold, the extremities are cold, and aircon the shivering already. Take this. After some time.
Very good for her work. Her work see a lot of computer, very tiring. This
So
黄芪呀。
do my introduction about this original point. It helps.